Welcome back to RFL. I'm Andrew Whitman, in tonight for Richard French. We continue our interview now with Republican Congresswoman Nan Hayworth of New York Hudson Valley, going to be running in the 18th District this November. This is the first time I've had a chance to talk to you since the selection of Paul Ryan as the vice presidential nominee for your party. You serve in the House with Paul Ryan. Tell us a little bit about him in 30 seconds if you can.
Man of principle, a man of honor. He is courageous about bringing forth a plan that he really feels will serve the needs of our economy and of our crucial programs, Medicare and Social Security, and of future generations who are going to need jobs and opportunity and also will want to rely on those same programs. A
lot of focus on reducing the deficit in his plans, and as you mentioned, a lot of focus on Medicare. That's been getting a lot of attention the last couple of days, and certainly there's a healthy debate going on about the plan and the future of Medicare. Critics look at some of the specifics that have been proposed by Congressman Ryan. They say it could lead to cost spikes, could cut doctors in hospitals, could cut nursing homes, could lead to a two-tiered system so that healthier and wealthier patients are in private plans or unhealthy or poorer patients are in public plans. However, the argument in favor, or one of the biggest arguments in favor of Paul Ryan's plan, is that the program could be unable to cover all seniors by as early as 2016, as late as 2024. It depends on
Absolutely.
who you talk to at any one time.
Right.
You're convinced that the Medicare voucher plan that he is presenting will still provide ample coverage for all seniors down the road, even low-income seniors?
Well, yeah, absolutely, Andrew, and it's very important, and let's resolve right here on RNN, on Richard French Live with you to get this right. It's not a voucher program. It's premium support, and there is a material difference. With a voucher program, you're getting a check, which you deploy electively, let's say. And certainly vouchers are proposed for various things, including school choice, and they may very well have a role there. But what we're talking about for Medicare is premium support. And the material difference is that with premium support, Medicare's paying the premium. Seniors choose from an array of programs. All of them will be covered. The idea, the word voucher says, gosh, some people might not be able to afford coverage. Everybody will get coverage, irrespective of their ability to pay.
Will they be able to get the coverage they want?
They will be able, the idea is that they will be able to get the coverage that they want, the coverage that they prefer. There will be, this is the Wyden-Ryan plan that was incorporated into the 2012 Path to Prosperity budget. It's a very responsible, compassionate budget. And what it says is that region by region, there'll be an auction process among insurers who will offer their plans, a so-called reverse auction. The second least expensive plan that meets the criteria that Medicare sets will be the basic plan, if you will, and premium support will be provided for every senior who chooses that plan. And by the way, this would be for seniors who are, for anybody who's under 55 right now. Right. Current seniors and those 55 and over, all of them would be able to have traditional Medicare or have the option of this premium support idea. But
there's been a lot written and a lot of criticism about this plan, in that there may be a number of seniors who want a coverage level that's higher than the reimbursement would entitle them to, or things may come up that may drive that price higher and they would have to pay out of pocket. Are those criticisms unfounded, or is there some validity to them?
Well, not to the idea that people won't get the coverage they need. The idea is that no one will have to go into financial harm because of the insurance plan that they need. There will definitely be allowances for seniors who have more serious medical conditions that require greater help. The idea is to provide the appropriate level of support for everybody who's relying on Medicare, but to do it in a way that allows consumer choice and competition among insurers region by region, allowing for local differences in the way we provide care and the way we prefer to have care and in the prevailing economic conditions within a region. But we use that choice and that competition to help us to afford to continue to provide Medicare benefits to everybody who relies on them. Because right now the alternative plan is, number one, for Medicare for the trust fund to run out, and then there's nothing, and no alternatives have been proposed. Current law says Medicare is going to run out, and we don't have anything to offer, and that will be an immediate and severe blow to seniors, and also to have the Independent Payment Advisory Board, which is going to determine reimbursements and immediately limit access to care.
I want to switch to the topic that you and I have probably spent more time talking about in all the times that I've interviewed: jobs.
Yeah.
You're coming towards the end of your first term in office, 2 years. Name for me 3 votes that you've taken that have helped create jobs.
Well, absolutely. Well, for one thing, I've voted for the Jobs Act, which did pass in March, passed the House and the Senate, was signed into law by the President, which was an immediate way to provide a boost to emerging companies who want to find investors and to grow, and it allows an easier path for them to do that from the standpoint of the many regulatory burdens that stand in the way right now. And we're already seeing an increase in the number of companies that have decided they can go public and grow and attract investment. So that's one. 2, I have voted for 2 bills to extend the 01 and 03 tax structures for at least another year, and then to reform the tax code, which is widely agreed that it's burdensome, it's overly complex, it's overly costly, and it is driving jobs out of the United States. It's driving enterprise out of the United States. So that's a second. In fact, that's 2 votes that I've taken. So that's another pair. And the third one is that I voted, and there are more, but I voted to repeal and replace the 2010 health law, which relates, of course, to Medicare as well. That's $710 billion, more than that estimated out of Medicare. But in addition, it is an impediment to hiring today, because employers, and they will tell you, they don't know what's coming up in terms of increased costs, except that they are going to be hit with mandates, penalties, and increased taxes, and that makes them not want to grow.
And I understand that point, but we've talked many times about creating jobs and about President Obama's job record or jobs record. I want to show you a couple of things. One is that jobs gained and lost. Those on the left-hand side of the screen, the numbers that of job losses under the end of President Bush's administration, and there you see positive job growth.
This is starting in 2008.
That's correct.
Yep.
But then you get positive job growth starting in March of 2010 and
but
going
if you
forward.
look at the net
going
loss, Andrew. If
no,
you
I
look
understand.
at the
I understand. But a
area under the curve, or over the curve and under the curve.
But I think you can make a valid argument that the graph, the left-hand portion of the graph, a lot of that is the hangover from the recession that hit in 2008 as the economy cratered out. Now,
but if you look, we've still a net loss of about
no, I don't think anybody's
4.2 million
particularly
jobs, Andrew. We have more people unemployed and at the poverty level than ever in decades in this country.
Nobody is satisfied with the speed of the recovery. No. Nobody is. But there is a recovery that is underway, at least when it comes to jobs. The second part of this question has to do with corporate profits, because you're talking about repealing and replacing Obamacare. You've talked a lot about...
Which I never refer to as Obamacare, you know that.
Fair enough. You've also, and your party has talked a lot about trying to make the business environment better and eliminating regulations and that sort of thing. These are corporate profits in the United States. They're at an all-time record high. If they're at an all-time...
If you see from where they started in 06.
But they're at an all-time record high right now. So companies are making bigger profits than they've ever made before. You and your party are arguing that if we only make their profits bigger, they'll be able to invest and they'll be able to hire more people. Why is that a valid argument if they're already not hiring the people that we'd like them to hire while making record profits?
Well, Andrew, that's actually not what I'm saying. What I'm saying is that we need to make the environment in the United States friendly to hiring and growth. So that's the argument, is that this has become, this country, for reasons that we can fix, this country has become a place that is not conducive to investment in additional facilities for manufacturers, let's say. It's not conducive to hiring in a number of regions in the country, some more than others, because we have the highest corporate tax rates in the world, we have the highest rates on individual and small businesses in the world, and they're going to get higher if we don't act now.
But if if corporate profits are already at a record high, how does increasing corporate profits even further and making an even more business-friendly environment inspire them to do something that they're not doing now while they're making record profits?
Andrew, this is about making sure that this country is a sensible place for any business, small or large, and 2/3 of jobs are created by small businesses. For any business, small or large, to actually continue to grow. And we have a climate that, between regulations that exist on the books now and those that are rapidly being written and added to, thousands of pages of new regulations between the 2010 health law and the 2010 Dodd-Frank law, we are creating a situation in which it's true, a lot of corporate investment is sitting on the sidelines. And they're looking toward the future. They're looking toward 2013 and seeing that tax cliff coming and seeing a raft of new taxes associated with implementing the 2010 health law and saying, we're not doing anything right now because it's going to be more costly to grow here and to hire here than in other places in the world. And we have to think about our customers. We have to think about how we can afford to compete in a global economy. And that's a very different situation than we faced right after World War II, which is what most people's frame of reference is.
It's an interesting debate. It's an interesting difference in perspectives. Our conversation with Congresswoman Nan Hayworth will continue in just a moment. We're going to talk Obamacare, or I'm sorry, healthcare reform, because you don't refer to it as Obamacare. That's next. Stay with us.